They're our babies.
These playful Yorkshire Terriers keep Pam Gelbert and her husband Michael quite active. Between playing ball and taking the dogs on walks,
Come on, Gus. Come on. Let's go.
the retired couple stay on the go. But one day, a sharp pain in Pam's leg almost stopped her in her tracks.
I was just walking around, and then all of a sudden it just felt I couldn't walk at all. I didn't know what happened. It got all swollen, and I was afraid it was a blood clot at first.
An ultrasound determined a varicose vein in Pam's leg had ruptured. For nearly 30 years, Pam has suffered from the condition, where veins in the leg near the skin surface bulge out and blood flows backwards through them. But now the pain was worse than ever, debilitating her.
This backward flow of blood down to the legs rather than up towards the heart causes pressure on these veins, which are not made to sustain that kind of pressure. And slowly they start dilating and become prominent to the eye. And that's what we end up calling varicose veins.
Surgery, known as vein stripping, has been the standard treatment to remove these veins. Now patients like Pam have a new option, a laser treatment that completely closes down the bad vein. Dr. Abbas Chamsuddin, Director of Interventional Radiology at Emory, performs the procedure.
The entire idea is, rather than taking the vein out, why can't we close it down, shut it closed, and leave it in place, let it scar and slowly fade away.
Doctors place a catheter into the varicose vein and numb the area around the vein. Using an ultrasound machine as a guide, a laser fiber is threaded into the catheter. When the laser is turned on, it collapses and shuts down the vein. The body automatically reroutes the blood to healthier veins. The outpatient procedure is quick, there's no anesthesia, and patients are encouraged to return to their normal activities immediately.
It was over in a half hour. There was no downtime. I mean, I got up right after it was done, and I walked for about a half hour, and there was no pain in my leg.
Pam and her dogs hope this procedure will help her get back to the things she enjoys most. For Emory, I'm Rhonda Rowland.